This is a short informational video about
Herpangina. It's ugly.
Herpangina is an acute febrile illness associated with small vesicular or ulcerative lesions on the posterior oropharyngeal structures. These ulcers begin to appear within 2 days after the initial infection. The ulcers can typically be distinguished by their light gray color and red border. They are sometimes confused with aphthous mouth ulcers. This highly contagious virus typically occurs in the summer and early fall months and is known to spread in childhood centers and schools. Herpangina is usually caused by a certain strain of Group A and Group B Coxsackie virus, echovirus, and enterovirus 71. Enteroviruses are small, non-envelope, single positive strand RNA viruses. They are capable of surviving in a wide pH range and retaining infectivity in temperatures of up to 122 degrees Fahrenheit. These characteristics make them capable of surviving in the environment for several days. It is most common in children younger than 7 because they do not yet possess the antibodies that defend against it.
What's an antibody?
Newborns, immunocompromised, and pregnant patients can develop more severe disease. If a pregnant woman contracts Herpangina, the virus may affect the unborn child. The infant may be small for their gestational age, have low birth weight, or be born prematurely. If a pregnant woman contracts Herpangina, she should consult a doctor as soon as possible. Male and females are infected at equal rates, and humans are the only natural host of these viruses.
It's a sickle cat.
Herpangina was first recognized in the 1920s, but the exact etiology was not described until almost 30 years later. In the summer of 1947, Gilbert Daldorf described the Coxsackie virus, and eventually named it after the town of Coxsackie, New York, where it was first discovered. Typically, the viruses spread when fecal matter from an infected individual encounters the mouth area. This fecal matter can be carried on the hands as well as on objects or surfaces.
You wouldn't believe the size of this thing.
The virus can also be spread via the spray from a cough or sneeze of a person with Herpangina. The virus has an incubation period of 3 to 5 days. Patients are most contagious in the first 1 to 2 weeks of infection. However, respiratory viral shedding can persist for up to 3 weeks, and it can stay in the stool for up to 8 weeks.
Symptoms.
Early symptoms include sore throat, pain when swallowing, headache, sudden fever, neck pain, swollen lymph glands, loss of appetite, drooling, and/or vomiting. Most symptomatic patients report malaise and high-grade fever, which may be enough to provoke febrile seizures. Young children usually exhibit fussiness, poor feeding, and anorexia. One of the biggest risks associated with the condition is dehydration, caused by the individual refusing food or water due to discomfort or lack of appetite. Symptoms of dehydration can include fatigue, decreased urination, and dry mouth. If you suspect dehydration, seek medical attention right away. Proper rehydration with an electrolyte solution is recommended. Although Herpangina is primarily a disease that affects children, adults can contract it too. The primary difference in symptoms is that adults will not drool or vomit.
Treatment.
The infection causing Herpangina will usually go away without any treatment in 7 to 10 days. There are supportive treatment options to relieve the symptoms caused by the infection. Over-the-counter ibuprofen and Tylenol can be used to ease pain and lessen fever. Anesthetics such as numbing throat lozenges, mouthwashes, and teething gels may be helpful to reduce the pain caused by the ulcers. It is also important to take in plenty of fluids during infection and recovery to avoid dehydration. Water and cold milk are typically recommended as they are easy to swallow and can have a soothing effect. While herpangina may heal without any treatment, it may rarely be followed by various complications such as meningitis, encephalitis, cardiomyopathy, or even death.
Standard treat. Mental man.
Herpangina may make it difficult for young children to keep up with their dental hygiene because of the painful sores in their mouth. Even so, emphasis should be placed on oral care. It is recommended that patients rinse their mouths with normal saline after meals. Younger children can have their mouths wiped with normal saline. If saline is unavailable, salt water can be considered. The patient's diet should consist of light, liquid, or semi-liquid foods, such as protein shakes with adequate calories. Hot, spicy, or irritating foods, like chips, should be avoided. If you have been diagnosed or suspect you have herpangina, you should reschedule any dental appointments for a later date to avoid spreading the disease.
Prevention.
Hand washing is the biggest preventer of spreading herpangina. Take special care to maintain hand hygiene when handling used tissues or soiled diapers. Soiled clothes, sheets, and towels used or worn by affected people should be washed in hot water. The sick person should take care to cover their nose and mouth while coughing or sneezing. And avoid sharing plates, cups, towels, or bedding with someone who is ill.